What science explains driving restrictions for epilepsy patients? Imagine being told you can't drive even though you feel perfectly fine most of the time. That's because science shows us that seizures can impact safety behind the wheel. When someone has epilepsy, their brain experiences sudden bursts of electrical activity, called seizures, which can change awareness, movement, or behavior. If a seizure happens while driving, it could cause an accident, risking the driver and others on the road. Research indicates that people with epilepsy do have a slightly higher chance of being involved in a car accident if their seizures are not well controlled. But it's important to note that the overall risk is still lower than many other common driving risks, like young drivers or those under the influence of alcohol. Interestingly, the longer someone with epilepsy remains seizure-free, the lower their chance of having a seizure while driving. Science guides driving restrictions by recommending that individuals be seizure-free for a specific period before they can drive. Typically, this period is at least 3 months, but some regions may requiring 6 or even 12 months without seizures. These time frames are based on studies showing that the risk of having another seizure drops significantly after several months of seizure freedom. The longer the period without seizures, the safer it is to consider driving again. However, these rules are not one-size-fits-all. Medical experts emphasize that each person's situation is unique. Factors like the type of seizures, how well medication controls them, and individual health history all matter. Not all seizures are the same. Some only affect movement or sensation, while others impact consciousness. Some happen only during sleep, which might carry a different risk profile. That's why doctors and medical advisory boards evaluate each person individually. For example, someone whose seizures only occur at night and never interfere with alertness during the day might be allowed to drive sooner than someone with frequent daytime seizures. Changes in medication can also influence driving safety. When starting or stopping epilepsy medication, doctors often recommend a pause in driving until stability is confirmed. This is because adjusting medications can sometimes trigger breakthrough seizures. Laws about driving with epilepsy vary widely depending on where you live. In many places, people are required to report their condition to licensing authorities and provide medical proof of seizure control. The goal is to ensure that restrictions are fair and based on solid medical evidence. Honesty with healthcare providers is crucial. While some might worry about losing their license, being truthful helps keep everyone safe. Most people with epilepsy want to drive responsibly and avoid risks. When doctors and patients work together, restrictions can be tailored to individual needs, balancing safety with independence. Most importantly, with proper treatment and management, many people with epilepsy can drive safely. The key is controlling seizures and following medical advice. The restrictions are there not to punish but to protect everyone on the road. Science shows us that the risk of accidents related to epilepsy decreases as seizure control improves and as the seizure-free period lengthens. So, staying compliant with treatment, being honest about your condition, and understanding your own risk profile are essential steps. In the end, driving restrictions for epilepsy are rooted in scientific evidence that highlights manageable risks. They aim to keep roads safe while respecting each person's individual medical situation. Always consult your healthcare provider for personalized advice, and remember that safety and independence can go hand in hand when epilepsy is well managed.